Alright class, we're going to be continuing our discussion today about minority health from last class. So now we have a basic idea of what minority health is. There's probably a couple questions many people have, maybe some of you in this class, and is why should we study minority health? How do we study minority health? Why do I need to study minority health? So we're going to start off with a short clip that might just answer some of those questions and show you how important minority health really is.
The statistics are staggering. Study after study shows that the health of minority men, women, and children in this country, particularly those living in poverty, is dramatically worse than the health of the population at large. The disparities mean higher incidences of disease.
Among blacks, the prevalence of obesity is 51% higher than it is among non-Hispanic whites.
African Americans have the highest morbidity and mortality as a result of being overweight and obese.
African Americans with heart failure are admitted to the hospital far more frequently than their white counterparts.
Hispanic American children have a much higher predisposition to accumulate body fat, which leads to obesity.
Latinos living in the United States are at an increased risk for developing both diabetes and complications related to diabetes.
African American women nowadays are 20 times more likely to be infected with HIV than white women.
The list goes on, but here at the UAB Minority Health and Health Disparities Research Center, we're fighting these statistics by finding the answers to why they exist, thanks to an investment that is cultivating new research, new researchers, and new funding critical to both. It's a 3-point investment made possible by your generous support, and it started 6 years ago with a man who's well acquainted with 3 pointers. In 2004, NBA All-Star and Alabama Sun Charles Barkley set his sights on a new goal: advancing health equality in the Deep South by partnering with the UAB Minority Health and Health Disparities Research Center. To date, this partnership has raised more than $2 million to support UAB's commitment to that goal. The Barkley Health Disparities Research Awards have provided pilot grants to 17 young investigators to seek real solutions to the real-life health challenges of minorities throughout our region.
Alright, so as you can see from the beginning of that video, some pretty staggering statistics about, and they're all about different minorities. And also pretty cool that Charles Barkley has become a representative for minority health and a proponent trying to get new research and new researchers for this big topic. Alright. So why should we study minority health? Well, as we covered from our last class, minorities make up about 1/3 of the U.S. population, and we've all heard of the United States being a melting pot, a bunch of different ethnicities coming together. Well, this change is going to keep happening, and they predict by the year 2042 that the minority will actually become the majority. It is important to remember that as we look at minority health, that race is not a scientifically valid biological concept. What this means is that we need to not look at race as just like, we can't generalize race. We need to understand that there are multiple ethnicities and multiple different kinds of people within a race. You can have 2 different individuals, one from Mississippi, one from Haiti. Both are black, but both come from, are worlds apart when it comes to culture, and they probably have completely different patterns of health behavior. And as we see here on the graph, we're looking at Hispanic Americans in the United States. This is a graph from our book. And when you think Hispanic Americans, some people might just think, okay, Mexicans, mainly Mexican. But as we see on the graph there, only 64% of Hispanic Americans in the United States are actually Mexican Americans, and the rest of the percentages are being made up of many different ethnicities, including Puerto Rican, Cuban Americans, people from across the Caribbean islands, as well as other ethnicities. Another example of variance within a race is Vietnamese Mexican Americans have a low median income and a low mean average age, where Japanese Americans and Cuban Americans have a higher mean income and a high mean age. So even though Vietnamese and Japanese both fall under Asian, they are completely different spectrums of the completely different health patterns. And the same goes with Mexican and Cuban. They both fall under Hispanic Americans, but yet are on different spectrums when it comes to mean income and mean age. So even as we look at the majority, white people, they still have multiple different variances within the white majority. There's Irish, Italian, Swedish, and German Americans, all are under the white majority but have different health behaviors. So how do we study these minorities? How do we study minority health as a whole, since race is so variant? It is important that we look past the obvious markers of skin color and language, and make sure to include things like culture, country of origin, and socioeconomic status. Another example of something to look at when looking at minority health would be their education level. Out of 182 Americans currently with health insurance, 12% have less than a high school education, where out of the 36 million Americans who are uninsured, 26% of them, that's almost double the percent of people who are insured, they have less than a high school education. And the numbers basically flip when it comes to college education. 29% of insured Americans are college graduates, and only 12% of uninsured Americans are college graduates. And this is because as the level of education increases, so does access to higher skilled jobs, which has availability to provide healthcare coverage. Next, we're going to look at a figure from our book. This is figure 8.4 from our textbook. And this gives us a good idea of some more things that we can look at when we're examining minority health. So we start off with a certain race here, and then we can break it down into multiple different factors, like biological factors, cultural factors, socioeconomic factors, or even political factors. And after that, we can take each section and break it down even further into things like, under biological factors, we can think of things like health practices. So does someone smoke often? Do they drink often? What's their nutrition like? Then we can look at, for socioeconomic standards, we can look under environmental stress. Where does this person live? Does the residence or where they live cause them stress? Does their job cause them stress? Things like that. And then political factors. So what kind of medical care, how does the healthcare system treat this certain race? Do they need more care? Do they have access to the care? And how is the quality of their care? Then, of course, everything is a biological process, which leads to a health outcome in the end. So as we can see that why we can't generalize race as one big thing, we need to look at different factors and break it down as much as we can, because there are so many different factors that affect everyone's health outcome. All right, and the last thing we're going to talk about is health literacy. This is an important part of minority health because many ethnicities have troubles with health literacy. Health literacy is the degree to which an individual has the capacity to obtain, process, and understand basic health information and services that are needed to make appropriate health decisions. So, on average, what percentage of American adults do you think are health literate? Yeah, Kayla?
50%.
50%. Surprisingly, it's estimated that 9 out of 10 adults lack proficient health literacy skills. So 1 out of 10 has proficient health literacy skills. And an absence of these skills can result in poorer health outcomes. And some of these include increased incidences of chronic illness, a higher risk of hospitalization, low health knowledge, or less than optimal use of preventive health services. Some examples of these health literate skills that I'm talking about include oral communication, so talking with your doctor, having the correct grammar to be able to understand what they're saying, articulating health concerns, being able to describe symptoms, not only to other people but to your doctor especially. You need to be able to describe what you think is really painful or not that painful, things like that. And then math and numeracy skills also are pretty important. Healthy People 2010, which is a nationwide organization, they put out a magazine every couple of years. They had two key areas that they wanted to work on as far as health literacy goes, and these two areas as of 2010 were to develop materials for audiences with limited literacy and to target the development of these health literacy skills that I mentioned before. All right. So, staying on the topic of health literacy, we're going to be looking at some prescription labels and your guys' abilities to be able to read them. How many people here, by show of hands, can I see have had to take a prescription medicine before? Mostly all of you. That's pretty common because illnesses often require prescription medications to get better. So, and as we can see here, there are many multiple things that are labeled with different letters there that are pretty important. Pretty important to the prescription label. And believe it or not, it said that 1.5 million preventable medication errors occur each year. And a study in 2007 found that 1/3 of patients didn't realize that the saying "take 2 tablets by mouth twice daily" meant 4 pills in a 24-hour period. So we're going to be taking a look at an example of a label and see how many parts we can identify. Can I have anybody tell me what the letter E is? That's right. That would be the name of the prescription, the name of the certain drug. And what's pretty important to go along with that is right next to it, that is the strength of the drug that you're taking. So in this case, it's 500 milligrams. That can be the difference sometimes in having to take 1 pill daily or twice daily, 2 pills daily, depending on the strength of the pill. And some other things to look at here. We obviously have your pharmacy where you pick up your prescription and their phone number and address in case you have questions for your pharmacist. And we're going to take a look down here now at what some of these other things on the prescription actually are. So like I said, there's your local pharmacy with the address and phone number in case you have any questions. Right here is the number that is used for your certain prescription. So that's the number that they put into the computer, and it'll tell, do you have any more refills left? What the drug is that you need, things like that. Right here is obviously the person who the drug is for, and then underneath that is the directions for how you're supposed to be taking that drug. It usually tells you how often, how many, and when you're supposed to take it. In this case, it's take 1 capsule by mouth 3 times daily for 10 days until all are taken, which makes sense because right here, by quantity, it would usually say 30. And we already went over that that's the name of the drug and the strength of the drug, amoxicillin, 500 milligrams in this case. And then down here will be the number of refills. In this case, there's no refills for this prescription unless there's doctor authorization. And then down here is a pretty important date. It's the shelf life of the date, so use before that date. Anything after that, any time after that date, you're not supposed to use the drug anymore. And then also your doctor's name is on the prescription. That's not too important to be able to interpret, but just so you know. So there are some pretty important questions that you should ask your pharmacist if you ever have any confusion about your prescription, and it's your right to ask your pharmacist. So make sure that if you have any confusions with your prescription, if you can't understand the label, ask your pharmacist. Ask them these questions: how much, when, and how often should you be taking your medicine? Should anything be avoided while you're taking your medicine? Are there any possible side effects with the medicine that you're going to be taking? Does it interfere with any other medications that you may be taking? That's definitely a big one. If you are on any other medications and you get a new prescription, make sure that you tell your doctor or pharmacist that you are on these other medications. You should ask them if they will interfere at all. And then when to stop taking the medication, if there's a certain date that they should stop taking them, or if there's a certain time you should stop taking them. All right, class. Tomorrow we're going to be having a guest speaker, actually a pharmacist technician, come in and talk to you more about prescription labels and more questions that you may have for your pharmacist. So I will see you tomorrow. Thanks, class.